So under ministry directive, all hospitals in Ontario have been asked to ramp down their elective and ambulatory patients. For Windsor Regional Hospital, starting Thursday at midnight, we will be reducing our ORs, our operating rooms, significantly. We currently have 17 operating rooms running across both campuses that will be reduced to 6 in total. This translates into about 600 to 700 patients a week that are scheduled to have procedures that will have to be postponed or canceled at this time. We're doing this mostly to create capacity in our hospitals. We're trying to learn from the experience in Europe, particularly in Spain and Italy, as to what happened with their healthcare when the capacity hit. They didn't have enough, and the healthcare system sort of suffered as a result of it. And learning from that experience, the Ontario government is trying to create as many beds as possible and as much capacity as possible, so that if and when this wave of patients who we expect to be sick with COVID-19 hits, we'll have the ability to care for them. And this again is a worldwide pandemic. This is not a Windsor-Essex problem. This is not a Ontario problem. It's worldwide. So when we create this capacity in our hospital, that would equate to about 150 beds. It may not be just for our local patients. It may be to care for patients across the province who may need those beds. All emergency surgeries will still go as scheduled, semi-urgent surgeries, but anything that's elective is going to be canceled.
So like stents?
Stents are still going through, so any cardiac procedures. And again, the principle we're using is that if we cancel a service that could end up leading to a patient coming back to our emergency room within days or weeks, that's not going to happen. So we have to preserve some of the services that are going to keep patients out of the emergency room. So stents will continue, and cardiac procedures will continue.
How many beds will this free up?
This will free up about 150 beds across both campuses of Windsor Regional Hospital.
Like a day or a week, or?
In total. So as the elective procedures start to get canceled, beds will free up because those patients are usually cycling through the beds. But once we get to our future state, and again, we're ramping down in a stepwise approach. We have 3 phases that was just approved by our medical advisory committee yesterday. The first phase will take effect on Thursday, but by the time it's all said and done and we've finished with our ramp down, we'll have hopefully 150 beds in terms of capacity.